Good evening, everyone, and welcome to this latest Medesk webinar. My name is Michael May. I am the Business Development Manager for the English-speaking aspect of our business, particularly in the UK. I'm just going to check the sound and video. So if you can all hear me and see me, and indeed see the slides moving back and forth, do leave me a little message in the chat, and you can use that as an excuse to introduce yourself as well. That would be great. So I will give you a couple of seconds just to say hello. And then we'll get started. Okay, great. Good few of you have said hello. Hi, everyone. Just a little bit about Medesk first, obviously, so you can see what kind of background we're coming from, what sort of context, what sort of world we're living in, and why we might have something worth saying about marketing in healthcare. So Medesk is first and foremost actually a practice management platform. So we bring together all sorts of different tools and different aspects of practice management all in one place just to make it easier for you, to make your lives easier. Now, the reason we're talking about marketing is because a lot of what we do, there's so much data and information collected purely by, booking people in and, running consultations, writing your notes and all sorts of stuff like that, that actually you gather a huge amount of information about people, about your patients, about the groups of people you're treating. And a lot of it can help you understand how they got to you in the first place and how you can keep hold of them. So a lot of what we do is part and parcel of that is analytics, and it fits very well with marketing. And so what we're looking at today is how to promote your practice without spending too much. Now, I didn't specify spending too much of what. You're probably thinking money, but I'm of course thinking also time and energy. We're all probably short of all three these days with yet another lockdown in the UK. So I know we're all sort of feeling it. My colleague Christine is here as well. She heads up the sales department and usually does the product demos for us, for the English-speaking people interested in our services. She's going to be keeping charge of the chat. So I will be looking at it from time to time, but if I've missed something, I'm sure she will bring me in line. And she'll have a little presentation of her own at the end as well, to just let you know a little bit more about Medesk if you are interested. And of course, we're going to have time for questions after that as well. So I expect you'll hear from Christine soon enough in the chat. And I'll just carry on as I intended. Okay, so the first thing I want to look at is really, because I understand that the vast majority of you don't come from a marketing background. Now, my background is clinical as well. So having been working for Medesk for several years now, the amount of experience I've gained with regards to marketing and generally how clinics are perceived by patients is sort of a different world, really. And it's not something that you necessarily are going to know about by being purely a clinician. Now, that has obviously partly to do with the fact that we're not educated in the beginning to be able to, promote our own services and so on. Obviously, we're all trained pretty much by the NHS, or other public bodies. And, the aim of the game is not there to, be tooting your own horn as such. However, it's kind of surprising to me in the sense that so many people end up being GPs, for example. And of course, if you're a partner in GP practice, you kind of want to make sure that GP's practice is is represented in the best possible way, whether it's private or not. And so yeah, it's a bit striking to me, but still, but that's by the by, I suppose. So what I really want to look at today is a little bit of marketing stuff that will be very applicable to your clinic, particularly as it relates to patient acquisition online and also patient retention in general. So it's a little bit of an infographic that I've taken from Google Think, and essentially it outlines the kind of 4 main situations that a patient is going to be thinking about as they have an issue. So whether that's they've just discovered a mole, or maybe they've got a certain symptom they're worried about, when they're thinking about actually going to do something about it, where can they go, and how can they actually avail themselves of the services. So as I say, these 4 so-called micro moments are broken down, usually for general marketing for all sorts of things, whether it's Coca-Cola or Starbucks or whatever. But these things are very, very applicable to healthcare as well. It's often perceived that healthcare is somehow special in that way, but human nature is human nature wherever you go, and therefore the same sort of rules apply, and the same findings apply, obviously with their own little caveats and changes. So before I proceed with a bit more explanation about each of these 4 micro moment types and how they apply to healthcare, what I'd like to know, just to keep a bit of a dialogue going, is how many of you have any background in marketing so far? For example, you might have taken a course, or somehow tried to learn a bit more about that, as opposed to just being purely clinical in your role, or purely admin in your role as well. I will give you a good few seconds just to reply if you'd like to. I really don't want to be this to be some kind of monologue where I'm just talking, because I can do that all day and it's not very exciting for you, I'm sure. Okay, so Sally says none at all, but want to do some over lockdown. James says years ago only, and Michaela says I have had a bit. Paul says only 1 course 10 years ago or more. Angela says none. The London Ophthalmology Centre says a few courses online, and Ravi says just learned some stuff by myself. So what I can take from that really is that most of you, or probably all of you since you're here, are aware that you kind of do need to know something, at least if you want to be involved in the process of promoting your clinic and your services and yourself as a clinician. But as a rule, your knowledge is either a bit out of date or it's sort of been self-directed, which is, it stems from the fact that, in the beginning we trained to be clinicians. We didn't sort of train to be self-promoters of any kind. Does that make sense? So that's good to know. It's just so I can know what sort of level to present this information at. So it's at the right kind of level for you to actually take lessons from, and go and then whether you want to look into your current activities, whether you want to look at marketing agencies, whether you want to use Medesk, for example, to analyze what you're currently doing and improve it. It just enables me to help you make that decision a bit better. So as for these micro moments, first one is about knowing. So it's essentially that moment where you realize there's something wrong and you kind of want to know something about it. What is it? Is it serious? Is it something I should worry about? So on. So what most people do, of course, quick Google search, I've got this symptom, and they see what happens. So what you want to be doing really in terms of your clinic websites and any way you represent yourself online is you want to be giving this kind of information to people. So you want to be demonstrating that level of knowledge. You want to be showing them that you actually have an understanding of what's wrong with them and potentially would be somewhere they can go. Now, after someone has kind of understood that they do need to go and see someone about a problem, that all the evidence online points to, they need to go and have it looked at, they will then, of course, want to know where. So they want to go somewhere, and you want them to come to you, right? So what you need to do is make it so that when they're looking online for someone, it's you that they find. So there are lots of ways to do this, and it's somewhat beyond the scope of this presentation. But broadly speaking, it's about getting at the top of the Google listings, really. You want someone to be able to type in, say, psychologist in my area, and it pops up with you or your practice. That's pretty much the idea. So there are lots of different things like search engine optimization that you can actually apply on a local level. So Google basically will show content such as yours for a specific area for the people looking for it in that area. So it's kind of like having a bus stop ad or a flyer within a certain radius of your premises. It is that kind of idea. Now obviously nowadays there's the other side of the coin where you kind of don't need to worry so much about how far away the patient is, especially especially if it's something like psychology, where it does do well enough with online services. There's not just a need to come in physically. So actually, there is the other side of that, where you don't need to so much limit yourself. It's more about showing yourself off everywhere, and making it clear that you're not just limited to an area. So it really depends on what you do, but you can apply either solution or even both, depending on whether it's appropriate to do so or not. And of course, once someone knows where to go, they need to know what to do. Should they actually proceed with what they're planning to do? And the way to do that is to build their trust. Now, you can do that in all sorts of ways. I mean, it can be as simple as displaying various different awards and affiliations on your website. A lot of people do that. You might say you work with such and such a lab. You might say you work with such and such an insurance company. You might have won a certain award. There are a couple of clinics working with us who prominently display the fact that they were one of Scotland's, for example, best SMEs of the year for healthcare, or in general, I think it was. Lots of stuff like that you can display. Even if you don't have things like that, you may well have academic papers you've published. Now, I'm not saying that your average patient's going to necessarily read all that and understand it, but the fact that you have publications to your name is something anyone can understand is a good thing. Peer-reviewed things are, people understand that. It means that your colleagues have accepted what it is you've got to say. Same applies for things like intro videos. You'd be surprised how much trust is built by just you showing the patients who you are. Now, you don't have to write some sort of cheesy bio where you pretend to be more personable than you are and all this kind of stuff. It's just a case of even recording a short video, sort of profile video, just to say what you do, what your sort of main philosophy towards practice is, what makes you different from anyone else. And that's doesn't sound necessarily that easy to do. Not everyone likes talking about themselves, but you'll be surprised how quickly things pull together if you just jot a few points down. Think about what actually drives you, and because that will be genuine, your patients will see it. And of course, the final point of this is when the patient is ready to make a booking, when they're ready to purchase your services, essentially, they want to know how they can do it. Once they're ready, what do they do? And of course, that brings me on to online booking, which is one of the easiest ways to get someone from just looking at your material, looking at your website, or being sent over to your website, to actually booking an appointment. So what I want to know before we proceed is how many of you are currently using any online booking tools, and how many of you are actually tracking where people are coming from in the first place? How do they get to you in the first place? Again, I'll give you a good sort of 20, 30 seconds just to respond if you'd like to. If there's radio silence, of course, I will proceed. I'll get the message, or lack thereof, should I say. Okay, so a good few answers coming in. I presume you can all see the chat if you were to click on the chat button, but I will just sort of not so much read through them all, but give you the gist. So we've got people who are using online booking. They are tracking, or at least recording, where people are coming from or where they're referred from, but they're not necessarily linking it all together by the looks of it. So we have most people saying, yeah, it's something that they're doing in terms of booking. So mostly bookings coming through. Yeah, but there's obviously that disjunct there somewhere. So that's what I'd say. That's one of the main things I've seen, not just today, but in general sort of practice. Not general practice, but my sort of general experience, I'd say. And that is that people are collecting all sorts of data. They know that they need to collect it. You're aware that this is important, but perhaps you're not so aware of how you can actually process that information. So you're gathering everything all together, but you're not really knowing what to do with it, or not really understanding how to apply it. And so that's what this next set of slides is going to look at, because optimization is very much in touch with minimizing expenditure, whether that's, again, time, energy, or money. Because the better you make something, the more efficient you make it, the less loss and waste that there is. And so the only real way to optimize something is to actually look at it and actually see if you can find patterns. Now, if you're just collecting the data, everything's coming in, you're just devouring information, but you're not organizing it, then there's not a lot you can do. I mean, you might spot a few things here and there and be able to rectify specific situations, but you won't gather the overall trends. You won't be able to understand where things are going. You won't be able to project. Now, from a financial perspective, you probably are, doing some sort of projections, or, you're trying to understand where the clinic's going in terms of money. But, are you doing it in terms of any other performance indicators? Cancellation rates, clinical effectiveness, reasons for cancellation, reasons for no-shows, reasons for people dropping out of the booking system, all sorts of stuff like that. By the sounds of those responses, perhaps not. And it's not as hard as it sounds to actually get together. So what I'm going to do, I'm going to show you a couple of examples that I've taken straight from Medesk itself. So these are all things you can do in Medesk very easily. These are literally just screenshots I took from different usages of the platform. So first thing is, how are patients currently finding you? So the only way you can really understand how to promote yourself online is by looking at how people are currently finding you. Of course, you can explore new opportunities, but it still points back to this kind of table where you're looking at whether people ended up going through that channel to find you. Now, the reason I've gone straight into this rather than looking how to build things from scratch is because the vast majority of you already have a clinic or have already been in practice for long enough that you've got some sort of patient list to be working with. So it makes no sense to start from the absolute beginning in this particular class. So what we've essentially done here is we're looking at all the different channels that you've been promoting yourself on, whether that's referral network, whether that's word of mouth, whatever it might be. Could be social media, anything like that. Pretty much anything where a patient might find out about you in the first place. And what we're doing is we're looking at how many people are coming in over time in each channel. And then we're looking at how many appointments that led to and how much money actually came in. So this is not a fantastic example. It's actually taken from our demo clinic. So there's only one demo patient that we're using mostly. But the point is that in the appointment counts, you can see that there are, a good amount of private referrals coming in, whereas the NHS constitutes, in this case, about 5% of the total. And you can see straight away how much money is coming in through each channel and what's the average amount per month. So you can see straight away which channels are actually worth it and which ones you should probably capitalize on. Now, as I say, these could be specific social media channels. They could be individual referral partners. There's no need to just say private referral. You'll actually want to say who it was. And Medesk does take that into account, of course, as well. And the idea is essentially then you know exactly where to improve, where to cut your losses. And you can often do so by just looking at your acquisition cost, how much it actually costs you to get one patient in through a particular channel, and then divide that by the amount that you actually got in revenue or from that particular scenario. And then you'll end up with a ratio between, it won't necessarily be between 0 and 1, it may be higher. But what you want essentially is to be spending less than you're making, after all the overheads and stuff have been considered. So this is a bit more of an example of how you actually would break it down, just zoomed in a bit, use a different table. And you can essentially see how many people are coming in through each different channel in this particular month. You can see how much you're making on average, and then the total. So it enables you to really understand quite quickly, especially if you're paying for a newspaper advert or you're paying for Facebook ads or something like that, you're going to know what those figures are that you're spending. So it's easy to divide it by how many patients you've got and then look at that compared to the amount that's coming in. It's simple arithmetic at the end of the day. So what I would say is it's never been the case that you've been incapable of doing this stuff. It's just that you didn't have the data in the right way to see those patterns. That's all it is. And you can look at all sorts of other deeper problems. I mean, I like to focus on stuff like cancellation rates and why cancellations happen, and linking that to things like channels and individual practitioners and that kind of thing. But that's kind of not really the point of this particular class. So I won't talk about that now, unless later on you particularly want me to. So one of the other things you can look at is which clinicians are most popular. So it may well be that you want to keep an eye on what patients actually expect in terms of who they're seeing, and making sure that every single person in your clinic should be there. So if you've got someone who hasn't got very many appointments, you might want to look into that, for example, and see why that is. What's actually stopping them getting appointments? Whereas if someone is getting a lot of appointments compared to the rest, you can actually look into why that might be. And it's you may be looking at that purely from a financial perspective, or you may be looking at it in terms of volume. There may be obviously things like wages and payroll and stuff to consider. You may actually be cutting back, for example. I doubt it now, in the current situation, necessarily. If you're working on your own, you're not going to be reducing your own hours if you want to, but you might be reducing someone else's hours. If you've hired a partner, for example, and it's your business, you might actually be looking for a way to cut back. So there are lots of ways to actually understand the workloads and whether they're appropriate in each case. So you can expand this, of course, to look at individual services as well, see what services are most popular, and you can cut back on expensive services that are not really used. So if you need to hire equipment or hire a room or something like that, then it's not really worth it. You'll be able to see. Likewise, if you see something's really, really, really popular, and you're not actually advertising it as well as you could be, you could actually capitalize on the fact that you've done a lot of one particular procedure or one particular therapy modality, and kind of say, well, look, 95% of what we do is this. That's why we've got so much expertise. We do so much of it. Easy things like that, and you've got the data to prove it, not only to the patients, but also to actually be confident in making such statements as well. And to be honest, what all this boils down to is having the evidence to be confident in making decisions. It's basically a decision support making tool. Now, as I've alluded to, really, Medesk does do a lot of this in terms of clinical side of things and business related stuff. But naturally, there's a lot of marketing input in here as well. And what I also like to look at is if your advertising is working and the numbers are generally okay, and you're more interested in finding out exactly what's coming in, who's coming in, rather than how much, then actually you can look at you can break things down by individual speciality or, again, individual services, and actually compare those things to those channels that people are coming from, whether that's individual referrers, whether that's an email, like a marketing sort of email that you've sent out, whether that's a Facebook comment or something you've written and people have taken notice of it, all sorts of stuff like that. And you can kind of understand what you're doing right and what you're doing wrong. And again, it's all about capitalizing on what you've done right and cutting back on what you've done wrong as soon as possible, and using the data to influence your decisions. And of course, one of the interesting things nowadays, and now this is for those of you who are more the sort of smaller end of the practice, where you might be hiring a room in a larger practice or in some other premises, and it has to do with when people actually want appointments and where they're coming from. So what I would say is if you look at how busy you are in different times and what you're actually doing in those times, you can then make a decision as to whether you really want to keep offering certain times a day or in certain locations, or whether you want to sort of promote certain times a day to certain groups of people and not mention it to others, to try and influence the decision to cut down on overheads. Again, mostly related to things like room hire and anything associated with that. But equally, it could be applied to the overall opening hours of your premises as well. You could very well only open on Friday mornings because no one wants to see you on a Friday afternoon, and all sorts of stuff like that. So it's very useful to know that, because the last thing you want to do, and I've had quite a bit of experience with this in the past few weeks, is clinicians where they've essentially hired a room for a month in advance, according to their usual hours. Lockdown happens, all the people cancel or want to use online consultations instead. It was all fine. Medesk, you can switch to an online consultation with a click of a button, generates a link the patient can use. All fine, not a problem in that sense. But the practitioners then still had to pay for the room. So, they still weren't necessarily making as much money as they could have been. And obviously, they've left the room empty that could have been used perhaps by someone else as well. So, there are all sorts of things that you can consider and dig into and understand. So before I proceed with a few actions that you can take with regards to how you're perceived online, which is how most people are going to be accessing your information these days, especially since they can't walk past your clinic, or perhaps shouldn't be, at random. So what I'd like to know really is, of the different examples I've discussed here, with looking at where people are coming from, what kind of things they're after, how many of you have dug into your analytics and your marketing and your patient acquisition to that level? And if you have, or even if you haven't, what have you looked at, and what would you like to look at in terms of your acquisition? Again, the traditional 20, 30 seconds for you to respond before I proceed. Pardon me. Okay, first couple of responses coming through, so we'll go through them as we can. So Swiss Physio says, had a look, but not really put one on one together to make sense to create an action plan. Now, yeah, that's a common thing, and that's really what I'm trying to push you towards today in a way. Not that Medesk is a marketing agency, but just to show you that you do have the power to actually put together such an action plan, whether or not you'd use an agency. You do have the ability to get those tools put together and actually make decisions for yourself. You don't necessarily need someone with external expertise to do that. James from James Pinkney Physiotherapy Clinic says not enough. Now, yeah, that made me smile a little bit, because it's really never enough. There's always more you can do. And sometimes, to some degree, you will end up picking and choosing, but hopefully the data will help you to pick and choose the right things. So Paul says, I've done a question source of referral with each patient over a 3-month period. Most were then word of mouth referrals. Now, and Swiss Physio says, likewise, 70% of word of mouth. So what is the next step? So yeah, so word of mouth actually, in some ways, is the next step. For many people, you're actually ahead of the game compared to many. So for me, word of mouth is kind of the holy grail, because word of mouth is what you get once you've already acquired a lot of happy patients. So you're already doing a lot of things right, which is obviously promising. It's obviously encouraging for you. In terms of what's the next step, what I would say is, if you look at your current patients and try and segment your patient base, whether it's by demographics, whether it's by what service they offer, what you can do is you create essentially a kind of patient profile, different patient profiles based on various combinations of these different characteristics. And what you can do, alongside asking them who it was that referred them, when it's appropriate to do so, that is, then you can actually look at other opportunities that are similar to how those original patients came in and then referred you these new ones. So if you're looking at, say, women over 50 in a certain area of the country, certain socioeconomic backgrounds, certain job, this kind of thing, even that may tell you that you should use, for example, Facebook over Instagram, something like that. So there are lots of things that you can infer, try out, and then see whether you were right. Now, some of this is a sort of like, you throw a few things at the wall, see what sticks. There is an aspect of that, of course, but you can use what I've just described rather briefly as a way to at least make an educated move forwards rather than just trying everything and nothing. So that's how I'd really answer that question. But for the rest of you, yeah, I mean, word of mouth is what you want in the end, as long as it's enough volume, which I guess for Paul and Swiss Physio, it's not. But yeah, word of mouth is great because people, of course, they trust their family and friends. That's why they are their friends. And well, I can't say that's why they're their family, but you get the point. And so, it's all about trust again. Except in word of mouth, someone else has built the trust for you, but based on what you did originally. So kind of a case of keep doing what you're doing, learn the lessons from where those people came from in the first place, original people, those 30%, and apply it again and keep applying it and keep optimizing and changing as you go along. And that's what the data helps you do. I hope that was, I answered the question enough. If not, I'm happy to talk later on in private, and we can discuss more. So what I want to look at now is a couple of actions, or more like 4 or 5, to be honest, actions you can take right away to boost patient acquisition. Now, these mostly have to do with your website and the way that you're perceived online. You can equally apply it to things like your Facebook profile, stuff like that. It is broadly applicable anyway, but basically, consider it applying to your website. That's where you want people to get, because that's where it is your unfiltered source of information directly from you. It belongs to you. You have full control over it. And that's the step where people get you actually into your clinic from just being interested parties. So the first thing I want to look at is the online booking experience. So, like, what can you do about that to make it worth doing? For the patients, why would they want to just book in with you there and then? Then we're going to look at the make sure your website is actually fit for purpose for the modern world. We can look a bit about branding, and also then a bit about what you can do for your existing patients. So if we go through, some of the most simple improvements you can make to online booking are actually the most effective, fortunately. So it's all about making it easy for people, of course, but not just for the patients. I actually mean for yourself as well, and also more specific. So as long as you can get a person pushed in the right direction, they can book exactly what they need, which makes them happy, makes you happy, and then you've got more chance of retaining that person in the end. One of the other things is live availability. So the way that our online booking works is that it automatically shows the patient when you're next available. Now, it doesn't mean it's when you're really next available. It means when you're next available in terms of when you're okay for an online booking to be coming in. And just to be clear, when I say online booking, I don't necessarily mean an online appointment. I merely mean the booking process that a person would go through on a website or online to get an appointment with you, whether it's virtual or physical. The other thing I would say is you should prominently display clinician biographies if you can, whether that's credentials, whether that's a bit of the background of the person, a photograph, these kinds of things. It's all quite straightforward. And what I would say is often, having seen this kind of thing, a person will want to book with an individual clinician. They'll like the look of that person, what they stand for, and they'll want to book with that person. So one of the easiest things you can do is actually put a booking link there that will book that person straight in with that clinician. So they'll click a button, they'll go through to a branded online booking portal, and then they can book the service they want at the time they want, and that's it. You can obviously make them prepay or fill out any validation forms, pre-screening for COVID, that kind of thing at the same time. But essentially, that's one way of acquiring a patient quickly and getting all the paperwork out of the way there and then, without it being too arduous. And one of the other things that online booking can be used for is actually leveraging your referral network. So there's no real reason for you to have just a contact form that your referral partner then has to fill out and then wait for you to get back to them, probably have a phone call, whatever else you might need to ascertain suitability of the patient. You can actually just give trusted people a direct link. And you can give them a link that will tell you it was that person who booked, and it will allow them to put all the information they need straight in there in that booking, and it will go straight into your calendar. You can obviously refuse the referral. That's up to you, but it's better to have it in the calendar and another patient waiting to go than it is to have someone waiting for you to pick up your emails or whatever it is you're doing to acquire those patients. So what I want to know before I proceed is, how many of you who are using online booking are using it to help referrals get in as well? And how many of you are, or rather, I'll leave a more open question. So how many of you would like to describe your online booking capabilities for me? So for example, do you allow people to book by service, by practitioner? Do you allow them to book specific locations? Do you allow them to choose between online and offline appointments? Do you provide them with a way to, for example, click a button and get all those things chosen in one step? And if you don't, if there's anything that you don't offer, for example, you don't allow people to book online consultations, you don't allow people to book with certain clinicians as a preference, is there any particular reason? Because it would be useful to do some myth busting, but also see whether you've got a genuine reason that actually, you have to stick with. Because just while you're answering, just to say that everything I'm saying today isn't necessarily going to be applicable to everyone. There are situations where some things are inappropriate and some things where they're more appropriate than others, and you have to pick and choose between two options. That, of course, is the case. Today is really just to give you as many ideas as possible and help you trying to apply these different ideas to your situation and understand what it is that you could be doing. That's really the idea. So Ravi says, not started online booking yet. I'm pretty sure that you will start very soon. The sounds of it. James says, by practitioner. So yeah, just as I was saying, really, choosing an individual person can be a very powerful tool because people are very influenced by what they see. They're very, very influenced by an individual, and actually seeing that the doctor is a human being and they actually see in advance who they're going to be with, that says a lot, and that really does build that level of trust. Paul says, my website does not facilitate online bookings. Bookings are made by phone call, email, and text. So Paul, is there any particular reason why they don't facilitate online booking? The reason I'm asking is because, well, Christine will talk about it a bit later, actually, my colleague, but we have a way just to put a link on there, a button that would actually give you that capability. This would be interesting to know. Maybe it's deliberate, I don't know, but you can tell me. Okay, so Paul says, I like to talk to my patients before I book them in. Now that obviously makes a lot of sense. I mean, in terms of the personal touch, that's great if you've got the time. Yeah, definitely. But in terms of liking to book them, helping to work out whether you can help them or not. So there are a couple of things you can try out if you start to get busier at some point and calling them becomes less realistic. For proper long conversation. What you could do actually is use online booking to get them to book such an initial discovery call, even if it's free. To actually give them that choice of time actually may increase your conversion of people who come to your site and who end up being patients, because they will see that you're definitely available at a certain time, you're allowing them to choose, and they'll book that in there and then. So I would recommend trying that if you haven't, and you probably will notice an increase in patients. And what you can do is do a bit of testing and see that sort of before and after, whether there really was a difference. If there wasn't, you can stop doing it. But if there was, you'll be glad that you tried it. And there's not too much trouble to put together a bit of booking that will allow the person to choose you, choose the time, choose the fact that it's an initial call just to ascertain suitability. And of course, you can actually ask a few questions as you go along. So you can actually put a form up there saying, please describe your problem. Do you have any of these symptoms? We're going to call you back. Is there anything else you'd like us to talk about? And you'd actually know in advance then what they all want to talk about. So if there's anything you need to research or anything you want to look up, anything you want to think about beforehand, you will actually have that opportunity as well. And that will all drop into your from your booking system into our management platform. So you're keeping everything in one place. Essentially, it makes it a lot easier. Christine, my colleague here, says it's especially good for not missing out on patients who try to book out of working hours. So that's great as well. Yes. So when a person has to make a phone call and then they can't get through because it's out of hours, or if they write an email in the evening and they know it's not going to get answered the next day, or they write a text message and you're simply not around to answer it even, it does mean that you can actually at least have them in the system, have yourself being aware of them if there's that online capacity. Because even if you're going to call them back, you can at least put that there like a callback request. You record their number, check it's genuine, and by doing so, you will know that they're worth calling back, and you can go ahead and do so. And we do actually provide like a one-time SMS code verification process that facilitates that as well. So Swiss Physio says, before the comment just now, says patients can book services and practitioners and of course times. Yep, good. Not sure what you meant with permit direct professional referrals. So what I had in mind was you can essentially piggyback on the online booking process for the purpose of giving your referral partners the opportunity to book an appointment directly into your schedule. So essentially, they follow the same pathway as your patient would, with a few different changes to make it more streamlined for clinical purposes. And essentially, they're booking into your calendar the same way the patients would. The difference is exactly who the person was and what channel it was in advance, because it's obviously that person. That's really all I meant. And the reason why that's good is the same reason why online booking is good for patients in general. It means that a person can get a referral straight in through to you. They'll understand that it's been booked because they'll get a confirmation on screen saying it's been booked. And they will be, they'll be confident that you'll then process that. You may well be calling them back and whatever else dealing with them, but at least they will know. They don't have to keep following you up or anything. They will know you've definitely got that. I see Swiss Physios said that they agree with the online booking being after hours. So I'm not too surprised about that. I'm sure that Christine will pop into the chat from time to time with a few things. If I miss anything or gloss over something, I'm sure that she will be there to point things out as always. So yeah, that's always good. What we're going to move on to then is just a few screenshots really of what I had in mind. So just to say, you can book by different services, book on a particular calendar day, and just going back to the idea of biographies and showing people who you are. Now, there is a certain degree of lack of willingness to sort of be out there and really show yourself off. And on the other hand, there are people who do it perhaps too much, but generally speaking, I would say the rule is people don't do it enough. And actually, there's nothing wrong with doing this, really, showing people exactly who you are. It's, like I say, very, very good for building up trust. It's good to show them that you actually have a personality, you're a real person. That's almost never a bad thing. I suppose it depends on who you are, perhaps, but it really does allow people to feel that extra bit of confidence to book with you. And if you combine that with something like online booking, they can pretty much say, "Hi, I'm this person. I do this. I do that. I can help you in this way, that way. Here's my button." And essentially, that's what this screen does here. And that's actually Christine herself. Just decided to use one of our own staff in case anyone else, got offended or I couldn't use their image or that sort of thing. And so you can do it that way. And so what I would say is you can do all this stuff for patients, of course, and but what I really wanted to talk about, and we kind of have because of the questions, but wanted to talk about the referral network side of things, because at the moment we're in a situation where everyone is struggling almost. And even if you're not, you'll probably know people who are, and you know people who could refer patients to you, and they know people that you could refer to them. So it's time to actually look into that if you haven't already, and particularly making that process nice and easy. And so essentially, as I've really described, what we do as part of the booking tools we offer is we do provide partner program tools where you get a unique link for each individual partner or clinic. And then you can then look into that as a marketing channel, essentially. And you can see who's most popular, what kind of patients they're giving you, what kind of services those patients want, whether those patients in turn refer more people to you. And you really get to see what the source of all that success or failure is. And again, you can apply those rules and those lessons to everything else again. So you see what works, see what doesn't, apply those things again, tweak it, change it, and move on to the next sort of challenge. And that's pretty much what it looks like inside our platform. You have a profile for each person. You get a unique link that you can copy and paste anywhere else. Just give it to them. And also, the good thing is that if you no longer want referrals from a certain person, you obviously want to tell them so. It's only right to do so. But at the same time, in case they're not listening, you can actually disconnect that link. You can stop it working. So if someone was to use that link, it would say, "Sorry, you no longer have access to this booking platform." So you can actually cut your losses quite easily. It's not a problem to do so. And again, just a bit of an idea about referrals. So in case you're wondering about who could you have referred to you, some patients, I would say generally it's kind of, for me, like a color wheel, really, in that you've got people who provide sequential services. In other words, services that are rendered before or after yours, as part of an overall treatment process or overall sort of treatment paradigm. And then you've got collaborative services whereby people are actually interacting at the same point of time. So it's not like someone does something, then you do, then someone else does. It's actually you're doing something together, and you can actually bring in external people to help you do certain things, and they can bring you in to help them. So it's kind of like, so the first is kind of like the color wheel, where you've got red, orange, and yellow. They kind of all work together in sequence, like a rainbow, I guess, in full, as you can see. And then collaborative services are more kind of like the opposites. They're kind of opposite but complementary. They're not obviously completely opposite in medicine. It's not really, doesn't work like that, but they are complementary rather than the same kind of thing. But they do work together. They're not a perfect analogy, but the pretty closest one I can think of. I can see that some people are writing at the moment. I will carry on while you're still writing, so I'm not sure what it's about. But if there's anything we need to go back to, we of course can. So what I want to look at now is how you can change your website a little bit for better success in terms of patient acquisition. And it has to do with some very simple things, really. And it has to do with partly speed, but also the mobile aspect of things. So I've got a question for you. What do you tend to do on average if you want to answer a question quickly? What is the one thing, if you had to choose one thing to do, what would you do just to get an answer to a given question? doesn't matter what the question is, Ravi. If there's any particular question you wanted to answer, like what's the price of milk, what's the price of bread, any question. Doesn't have to be. It doesn't have to be a question your patient is asking you. In general, in life, if you want to find the answer to a question, how do you do it? What's the most likely thing you probably do, especially if you're out on the move? So looks like Michaela's got the idea, or at least what I wanted people to say, which is pretty much Google it. Yeah, well, Christine goes to me. Well, fair enough. I can say that's a mutual feeling, to be honest. I also ask Christine quite a lot of questions. So yeah, Google it. I mean, that's what you do, right? You want to know what time like Tesco shuts. You Google it, right? What times did Tesco open now that lockdowns happen again? Do they shut early? Is my bank going to be open? You Google it. You don't ask someone. Well, I mean, you might ask someone if they're likely to know, but typically you grab your phone, Google it, you find the answer. Now, the reason I wanted to raise this point is actually serious, and it's because what Google now does since September last year, end of September, it actually puts mobile-friendly sites first in search engines. So if someone searches, maybe, I don't know, cardiology London clinic near me, something like that. It doesn't have to be a coherent phrase, actually. Google will look at all the sites that mention those words, and it will put them all in order of quality, obviously, but it will do that by seeing which ones actually work well on mobile phones first. So if your website doesn't work on a phone very well, or hasn't been specifically changed to work on a phone, it will actually fall down the listing, even if it's otherwise perfect. Simple as that. So you could be the best physician in the world for your specialty, but Google won't care simply because it has a blanket rule where it puts those mobile-friendly sites first. Reason being is it doesn't want people to use Google and then click on something at the top of the list and then spend 20 minutes waiting for it to open. So it kind of makes sense in the grand scheme of things. And in general, people don't want to wait for your page to open. If it takes too long, it's just loading and loading and loading, or things aren't appearing, they will go elsewhere. I mean, it's a consumer's world now. I mean, even in healthcare, if they're looking for private healthcare and your website takes 20 seconds to open, they're probably not going to wait that long. They're likely just to go back to Google, choose the next person in the list. That just is a fact. And actually, this is not just about your site in general, but it's about the patient's journey through your site as well. It's about how they gather information on your website, because if they are waiting 20 seconds for every page to load, they're going to take minutes and minutes of time, which they don't really want to spend, or maybe they don't even have that time, just to find the information that they're looking for. So if they click a bio page, it takes ages to load. If they click the booking page, it takes ages to load. If they look at the service page, ages to load. It all adds up, and eventually they just run away. And just a couple of slides here about bounce rate, which is essentially the same thing. If you don't know, bounce rate basically means the rate at which someone comes to your site, hits it, and bounces back away. That's kind of what they're getting at with this phrasing. And the longer your page takes to load, the much more likely people are just to click back. And it's actually, significance in terms of this is actually reached at a couple of seconds, really. I mean, you can see here straight away that after you get to about sort of 4 seconds, you're getting into significant amounts of people just running away. You're getting 1 in 5 people running away after 5 seconds just because your page won't load, especially on mobile, because they might be aware that their mobile signal's no good at the moment and they'd rather just quickly get onto a website if they can. Happens. And this data was actually taken from over 100,000 user sessions over a 1-week period. So it's definitely statistically significant enough to bear in mind, and it's certainly something you'd be thinking about now, I hope. And the same thing again applies to the pages, because even if they eventually get onto your website, if it keeps happening and it keeps being slow, actually you can see straight away that if it takes 2 seconds, they might visit as many as 9 different pages. Whereas if it takes 6 seconds to load, they're only viewing just over 4. So that's less than half the amount of pages. And it might be that because of that problem, it might be that your patient doesn't get enough information to make that decision whether to actually end up booking with you, or even just calling you up, or at least being aware that you can provide what they need. So it goes back to those 4 micro moments. This problem with pages loading slowly, or not being available on mobile, or not being seen on mobile, actually means, or Google through mobile, it actually means that you do actually lose out on those 4 micro moments I'm talking about. People can't find what they need to know, they can't find out where they need to go, they can't find out what they need to do, and they can't find out whether they should buy. So Swiss Physio asks, is the loading time related to the quantity of content on the page, so short pages better? Now, ultimately, yes. The more you have on there, obviously, the longer it takes to load. You got that right. But it actually also has to do with another couple of things, which is what kind of content's on there. So if you've got hundreds of megabytes of videos, it might take a while to load. In the case of video, maybe not, because it'll usually load when people are actually going to click on it. But in general, yeah, if you can have more than just text there, you want to make sure it's as optimized as possible. You want to make sure your logo is like a vector format, so it's nice, crisp, and low amount of data in it. So yeah, Christine's got a better explanation than me. So GIFs basically, and non-optimized backgrounds, pictures. So it is essentially moving images that aren't videos. So moving images that are loaded straight away. So you'll notice them in things like internet memes, like little cartoons and jokes and stuff in the wider sort of web. But in particular, it might be like patient education videos that you've kind of converted to animation, that kind of thing. And in terms of non-optimized background images, again, related to what I said about logos, it's those kind of images and pictures that are like maybe a bitmap format you might have heard of. It's the standard thing that Microsoft Paint saves things in usually. And you end up with pictures that are okay quality, they're fine, but they're huge in terms of their their weight. And that just means that the phones and the laptops and whatever are struggling to load something. And if the website's written in a way that forces that bit to load before the text, for example, or any other bit of the website, it does mean that by the time the patient sees anything useful, it's too late. Another thing that Christine's saying here is also things like badly optimized interactive modules as well. So if you've got different widgets that you've installed and different things like online payment portals and online shops and stuff like that, menus popping up from the side, all those kinds of things, if they're badly done, then it actually does interfere with the loading of the site. It interferes with how it's perceived on a mobile phone. And what you'll end up with is a really slow website that looks really bad on a phone. And because over half of patients are now looking at their phone at your website, even if they end up booking on the laptop later, that's obviously significant enough that you need to pay attention. So yeah, it is a serious problem, and it's not something that many people are that aware of, but they should be. So Swiss Physio says, how can I optimize things then? Is it worth to pay someone? Now, a lot of these things you kind of can change for yourself. Like some of the things we've mentioned here, you can certainly change. You could look at your logo on your site, see what file format it is, see how big it is, try and convert it to a different format. Just open it up on your computer, save it as a different type, and see if it's smaller but retains the same quality. Simple as that. I mean, you might need to play around a little bit if you don't want to pay someone to do it, but it'll be much better than having people just turned away because they can't even open your site properly, or can't wait because it takes too long. So also stuff like that you can do. In terms of things like widgets, you want to make sure that whoever's providing those for you actually has optimized what they're doing and is aware of what they're doing. Now, you would have obviously paid them to do that, so it's your right to go to them and say, hey, look, you're making my website run really slowly. What's going on? Yes, you can certainly do that. You probably won't have to pay them any extra to get them to do that. I mean, you can use lots of things. There are lots of different web builders and stuff that you're probably already using, things like WordPress, that sort of thing. They do have a degree of tools on there that you can actually assess the optimization of your website in terms of functionality as well. So it's worth having a fish around there. In terms of things like online booking, I'm a bit more qualified to speak about that directly because we do provide exactly that. And I would say that if you put Medesk in an iframe, so in like a page within a page, essentially on your booking page, you put Medesk inside that, brand it. It actually will run pretty quickly. It'll sort of it will load when the patient gets to that part. And so, again, going back to the amount of content, you do need a certain amount of content on there for Google to kind of notice the page and promote your page. That's true. But yeah, there's no reason to over egg the pudding and write thousands and thousands of words. I would say a given page should have at least 300 words on it, and probably no more than about 800 to 1,000. There's not really any need for more than that. And down to branding, why is that important? So branding is not necessarily something we think about when we think of healthcare. You're more thinking of your Starbucks, your Coca-Cola, that kind of thing. But it's actually very important because I had a prop here that I've actually moved away just a moment. And it's not deliberately scratched, but I chose this scratched one for a reason. How many of you recognize this logo that I'm showing up? And if you do, tell me what it is. Hopefully it's not too scratched that you can't even tell. Yeah, exactly. Starbucks, right? Now, one of the examples I want to show is that that's recognizable. Why? Because it's everywhere where they promote information about themselves. Same applies to you. It's as simple as that. And now what I want to say is with Starbucks, I chose that particularly, apart from the fact it's everywhere, is because they, a couple of years back, changed their logo. They used to have this sort of a round kind of like a circle around it, and it'd say Starbucks in it, and the mermaid's sort of woman with the tentacles was in the middle. They removed that circle, removed the word Starbucks, and yet people still recognized it. They were a bit like, that's different, why not? But they still knew what it was straight away. And, when things like, for example, Coca-Cola back in the 80s, when they changed, they had like some sort of Coke version 2 or something similar. I can't quite remember what it was. But when people did that, it was so different and so weird that it was no longer recognized, and they went pretty sharpish back to what they had. So you can see the influence that branding has in general life. And actually, it's exactly the same for healthcare. I mean, even looking at the NHS logo, it's not particularly inventive as a logo, but it is distinct. It is on everything they produce. It is everywhere. It's put on all the signs. It's put on all the patient leaflets. It's put on your clinic websites if you work in the public sector. It's everywhere. Even the public sector understands that. And so the ultimate goal for you is essentially to make that happen for you. Patient sees a particular logo belonging to you. They understand it's you. Now, it's obviously not realistic to think you're going to be the next Starbucks. You may well be, one or two of you, but in healthcare terms, but chances are not. But that's not to say you can't learn lessons from people and businesses of that size. And what I would say is that branding is all about a message, essentially. It's about having that consistent message, consistent transmission of values. Okay, Swiss Physio, no problem at all. You will all be getting a recorded version. I understand we have run over by about 20 minutes because we've been a bit overactive with the questioning and chatting. But yeah, you'll definitely get a recording, and you can watch it in parts if we end up making some sort of War and Peace out of the whole thing. Yeah, so you'll definitely get that. You all will. So branding in general is about consistency. It's about the same values that you represent everywhere. And it's about continuity as well. So when you are booking, what you want to do is you don't want to really have someone look at all your website, look at all your materials, understand who you are, and then be just shunted off to some third-party booking system where they're completely like a fish out of water, really, and they're not understanding quite what's happened. They're kind of just shoved off. That while people do end up booking anyway sometimes, and enough perhaps sometimes, the problem is really that they have lost that kind of continuity. They've lost the fact that it's you. Whereas what we do is we actually custom brand online booking. There is a little tiny thing at the bottom, kind of is powered by Medesk, but broadly speaking, it's just going to be your big logo, patient portal's yours, and everything's your brand colors and everything like that. So it means that you can integrate it with your website, both physically and in terms of the colors and in terms of the mechanisms. And it means that people can book straight through without even leaving your site. And they'll basically think it's your booking portal, as in you built it. That's what they'll think. And what this does, along with the fact if your website is good enough, it will give them the assumption of your competence, and it will increase their perception of your values. So I read a statistic recently saying that 75% of people actually find that the way a website looks determines how they feel about the competency of whatever that service is. So you can say, broadly speaking, that 3/4 of your patients visiting your site have made a judgment on you even before they look at anything else. So if you've got a really badly designed website, looks like it was made in 1997, and it's all a bit rubbish, the patient will assume that you don't really care about transmitting your image to them. They'll think that you don't really have any problem with not showing how good you are, or they will assume just that you're that bad. That's unfortunately doesn't sound very pleasant, I know, but unfortunately, that is human nature. That is human behavior, and facts don't lie, I guess. You can distort statistics to say what you like, but at the same time, 75% is quite a compelling number, I think. And so the last thing actually I'm covering now, we're almost to the end and we'll get to questions, is a little bit about your current patients. Now, this will apply to a few of you we spoke to earlier about those who have got word of mouth already. And hopefully it will apply to a lot of the rest of you as well. And that is all about being proactive about your current patient satisfaction levels. So you want to make sure your existing patients are really happy, because that actually will lead to you getting more patients. So it feeds into both patient retention and ultimately acquisition. Now, speaking completely cynically, the main reason for doing this is because retaining existing patients is cheaper than getting new ones. But that's purely a cynical view. It's also true that you want to make sure your patients are happy, because otherwise, why are you in healthcare? You want to help people, and you want to make a living while doing so. I think that's perfectly reasonable. And so there are really two aspects to this, which is the most proactive component, which is requesting feedback. Now, what I want to know quickly is how many of you actually request feedback on a formal sort of basis, on a systematic way. Do you ask everyone for feedback? And if you don't ask everyone for feedback, why is it case specific? Okay, so both Ravi and the London Ophthalmology Clinic say they ask everyone. Now that's great. And you give a link. That's perfect. That's exactly what you want to be doing. You definitely want to be collecting things. And again, yeah, quite right. Good or bad is how you learn. That's very true. And yeah, so Paul says as well, I gain verbal feedback from all patients. I rarely use forms to fill out. Yeah, and I mean, that's a good thing as long as you're recording that information and labeling it against the patient. And who that person is and what they've said and what they expect from you in future. Now that's still good that you're doing it at some level, obviously. And what I would say is that verbally doing so is great, because if you've got that rapport with the person, they are more likely to actually be honest with you and be straightforward and say what they think, both good and bad. And also doing it formally allows you to quantify it and to understand overall what's going on. And again, you can dig back into analytics and marketing and stuff like that and see where the happiest people are coming from and where the unhappiest people are coming from, and focus on the happier ones from that perspective. From the other perspective, what you want to do is be reacting to the feedback. Now, it sounds obvious. I know you're supposed to react to feedback. That's what it's for. But it's about how you react. So obviously, you want to thank people for the criticism. It is a learning opportunity, as the people at the London Ophthalmology Centre have said here. It is it's a learning opportunity, whether good or bad. You'll grow from it either way, and it's useful, especially if their criticism's being constructive. So you want to make sure that your questioning was conducive to that, obviously. And what is really, really important that you do, whether this is face to face with the patient or over the phone with an individual patient and just a personal matter, or whether it's a more of a global kind of thing, maybe someone left you a bad review online and you responded to it. Either way, what you've got to do is acknowledge the problem, if there is one, and then take action. And actually not just do that and fix the issue if you can, but promote those changes that you've made. So you don't have to, if it's something really terrible that you wouldn't want to publicize that even happened, you don't necessarily have to do this. But you would, in such a case, you would want to speak to the individual person that it happened to and say what you've done to change. And it may not be that they ever come back to you, but if there was a chance that they're going to come back to you, if you made a change, showing them that you'd done so would certainly push them in the right direction, and hopefully they'd be feeling a bit better about you next time. But in terms of the overall promotion of what you've done to change and be better, people often, they just want to know that they've been heard. They want to know that you've taken what they've said on board. They want to know that what they said mattered and that you did something about it. And what it will do is, first of all, reassure that person and anyone associated with them that might be able to book with you, but also it will allow you to show the rest of the world, the rest of the potential patients, that you do care, you do make a difference, you do change based on what patients have said, and that they can expect the same treatment. And it then feeds straight back into all that trust and so on that you build online, which is harder to do so than in person because they don't know you, they can't see you. And it's really just a way to show that you've made a difference. And that brings me to the end of my bit, as long as it was. We will have time for questions in about 5 minutes' time, but I do understand that my colleague Christine has a couple of words to say about Medesk itself in case any of you are interested. So I will let Christine have a word, and we'll both be around for questioning. So over to you, Christine. Thanks a lot.
Hi, can you hear me well? Can you see me well? Is everything working?
Yep. All good, all good.
All right, perfect. Let me just quickly share my screen with you as well. Oh, there we go.
Do I need to remove my presentation? No. Oh, yeah, good. Sorry. There you go. All good.
All right. Are we all good?
We are.
Yeah, lovely. Right, okay. First of all, I'd like to thank you all for attending our masterclass today. My name is Christine, as Michael mentioned already, and I head up our sales team in Medesk UK. I'd like to run you through a quick 5 minutes presentation, just outlining 3 ways to improve your clinic's workflow with the implementation of a medical practice management software. And obviously, I will use our platform, Medesk, as an example that can make your workflow a little bit more streamlined, a little bit more optimized, and more efficient, of course. There are around 700 clinics and solo healthcare professionals who use our platform on a daily basis. And so over the time, we actually gathered a great deal of experience in helping professionals in a variety of different medical areas and specialties. And 2020 has been harsh so far, gotta be honest. It's shown all of us how important it is to be flexible, especially for the healthcare providers. Gotta be accessible to the patients. And Medesk actually gives that ability to work from any device, whether it's a computer, a mobile phone, or a tablet, from any location, whilst having the constant access to all of the patient's records, financial, marketing reports, and consultation notes, obviously. Of course, it is fully GDPR compliant as well. You will also save hours of manual work by placing the online booking link, and we've discussed that a lot today. We can use your logo and add it to the online booking, can get it white labeled to match the color scheme of your website, and Medesk captures all of the online bookings and places them in your schedule. Patients obviously can select a service, a convenient time slot. You will receive a notification of their booking, and you can also attach a specific pre-appointment form for each of the services that you provide. So patients can fill those out during the booking process, and all of the forms will get attached to each of the patient's records. So obviously you will be able to review those as a background, get their idea of what they're after, and actually confirm their appointment. You can also place the online booking links on your media social pages, share with your referral partners. We make a unique link for each channel, and system will actually capture how many patients went through each of those. You can, of course, collect payments and prepayments through the patient portal as well. With our platform, you can achieve a completely paperless office. We have got plenty of experience in creating the most comfortable and easy to use and time-saving consultation templates from scratch for each of our customers. And we also already, as you can see, have a lot of those available in our library. You can also really increase your face time with the patients by simplifying the ways you enter the data and then passing it over to your patients and colleagues or colleagues. And all of the documents will be tailored for your clinics and then can be emailed or printed out or exported as PDFs directly from the platform. You can also make use of the BNF and ICD-10 databases that are integrated as a part of the platform. It also has a direct connection to the NICE Guidelines website. You can make use of your phone or a tablet to actually make voice recordings or videos or taking pictures and then directly uploading them to the patient's record. And that is also particularly useful for tracking down the progress of before and after the treatment. So in order to bring a little bit more efficiency to your workflow, you can use our analytics module, and you will be able to create pretty much any report and track down any kind of marketing related data and financial related data and medical related data that is available in the platform. You will be able to automate the recall and reach out to a specific demographic or like target groups of your patients via the emails and text reminders that you can send out directly from the platform. It can allow you to reduce the no-show rates and you can invite your patients to book like the follow-ups afterwards, or you can promote your special services or maybe offers. There's also a CRM that you can use for creating the tasks for yourself or your team and basically tracking down what has been done and what hasn't been done during the day in your clinic, keeping the records of the communication between the different team members, especially when working remotely. Sometimes, especially in the times like this, patients might be unable to attend your clinic in person for a variety of reasons like social distancing, but they still need a timely advice from a medical professional like yourself, obviously. And in this case, you can make use of our video consultations module where you can create a video consultation in literally a single click. You can let your patients book video consultations directly through the online booking, share those links with them, and they can be accessed from any of the device. As you can see from my silly GIF, that's me joining in from the mobile phone and actually joining in from my laptop. That was silly, I know, sorry. There are actually a lot more useful features in Medesk that can help you to improve your workflow. We have integrated with laboratories across the UK, which would allow you to send orders and receive the test results directly into the platform. Medesk also allows you to manage your inventory levels and control your stock. Please take a look at our website. We've got a pricing calculator if you're interested. It starts from £19 a month, and you can find the actual calculator in the pricing sections on our website. Actually, we have got plenty of experience, as I said, and sometimes there are a lot of the examples that we can share with you on how other clinics that we worked with dealt with different difficulties. So please do reach out to us. You can also fill out the type form that I've shared in the chat before. We are gonna send out to everyone who goes through the type form, gonna share our small PDF file with a nice summary of what has been discussed put up nicely with pictures on the patient acquisition. So if you're curious, you can just fill out the type form and I'll reach out to you and send that guide over. Overall, that's it from me. Won't take any longer. But thank you very much for attending. Thanks a lot for sticking around, asking questions, posting stuff, interesting stuff in the chat. And yes, thank you. Have a great evening. And over to you, Mike. We're going to stick around for a couple of minutes, 5-10 minutes, to answer your questions if you have any. But yeah, again, thank you.
Yep, thanks, Christine. Great as always. And yeah, just we'll be around for another 10 minutes for questioning. What else did I want to say? Probably nothing to add, really. Just thank you very much, all of you, for listening to so long. And yeah, if any of you do fill out the questionnaire that Christine posted, you will get access to a rather lengthy guide to patient acquisition and how marketing relates to that. It was written by myself in combination with our own marketing team. So there is general marketing expertise behind it as well as me. So yeah, do look forward to that. Just requires you fill out the short form that Christine has posted. Otherwise, thanks very much, everyone. Really appreciate you listening. And I'll be around for a few minutes.